Hey everyone, it's 5 p.m. on June 1st, 2011, and this guy I know on here on YouTube, Kaleb4UK, is having chest surgery soon on June 9th with Dr. Garamoni, so I thought I'd do just a quick video. Well, I hope it'll be quick. I'm just overviewing some things you can expect for surgery since I get a lot of questions about it. Of course, as with all my videos, this is just my experience. Everyone has their own experience with surgery, and some will be like mine, some will be totally different, just like people's tolerances to pain and things like that, and responses to tea will be different. I'm hearing a lot lately kind of in media, especially with Chaz Bono coming out, every transsexual is different. First of all, just to get out of the way, because I know I'm going to get a lot of questions about it, I had my own chest surgery on December 12th, 2006, in Baltimore, Maryland, with Dr. Beverly Fischer. I had double incision, that's why I have scars. A lot of people ask me what I did for my scars. They faded very well. Dr. Fischer's office recommends Palmer's cocoa butter formula with vitamin E. People use silicone strips, silicone scar strips, and also like different scar reducing creams, but this is the one I used and stuck with, Palmer's cocoa butter formula. It has vitamin E in it, so this is actually the very tube I used 5 years ago for my surgery. Definitely helps fade scars. I guess I could show my scars real quick. So the night before surgery, you want to make sure you're very well rested and you've eaten a good healthy meal, because you won't be able to eat or drink after midnight. Sometimes it's 9 p.m., depends on your surgeon. For the anesthesia and all that they'll give you, you don't want to be sick the next day. It's obviously a nerve-wracking experience, so it can be hard to sleep the night before. So my surgeon actually prescribes Ambien to be taken the night before and just, throughout recovery. It's kind of hard to fall asleep sometimes, and some people aren't back sleepers. You also should be taking your antibiotics starting 2 days before surgery. I'm pretty sure that's kind of a universal thing with all surgeons. But I know with my surgeon, Dr. Fischer, we had to start the antibiotics 2 days before. And a little PS, one thing you might want to take care of before the big chop is have some sexy time with your partner or yourself, because you cannot have sex for 10 days after surgery. This has to do with the anesthesia and the blood pressure and whatnot going up, but that is actually in Dr. Fischer's surgical instructions to not engage in sexual activity for 10 days, which can be, it can be very hard. No pun intended. Well, pun intended. So the day of surgery, you wake up, you'll go to the surgery center or hospital, depends who your surgeon is. I went to Dr. Fischer in Maryland. She has a small surgery center. Feels very personal. I've accompanied guys to their surgeries here in San Francisco with Dr. Brownstein, and he uses the hospital, and you just check in where everyone else does for surgery. You'll talk to the anesthesiologist. They'll ask you about smoking or if you've done any drinking or drugs, and be sure to disclose, just, you don't want anything to go wrong. Dr. Fischer actually sent out with her surgery info, a waiver that you have to sign saying, if you smoke cigarettes, that you'll stop 4 weeks beforehand. If you're smoking, you should definitely stop. Interferes with healing. So after you talk to the anesthesiologist, you'll strip down to your underwear. I didn't pack, just kind of felt uncomfortable. Do what you want. You can use the restroom. They'll give you, like kind of a hairnet. They'll either wheel you away into the operating room, or you will walk there yourself, like I did. Then they'll strap you down. You don't want to, be moving around. And they will give you some oxygen, and then put the IV in. And really, when people ask me, does it hurt? Like, does the surgery hurt, or what was the worst part? Really, the worst part I remember is the sting of the IV needle going into my arm. It really wasn't that terrible. And then, eventually you're gonna feel woozy and you'll fall asleep. You will be intubated. That was something that kind of freaked me out beforehand. I was kind of scared of surgery in general. Never had surgery except for getting my wisdom teeth out. But the idea of being intubated just freaked me out. But I didn't wake up during the procedure or anything. Didn't wake up while the tube was still in. But it's just something to consider. I'm just putting it out there because, I don't know, I like to kind of be prepared before I go into things. So I didn't remember the procedure at all. I actually woke up in the recovery room and asked them, is it over? But the only reason I really knew it was, done was because my chest was all bandaged and wrapped up and I was in my surgery binder. So it really was a painless process. It was kind of anticlimactic because I was so worked up, and then the surgery itself wasn't that bad. Now recovery, you kind of got to watch out for 6 weeks, what you do, with your movements and limiting your exercise, but the surgery itself is really not that scary. I've had a lot of people ask me, they're so scared and nervous, and I understand that, but there's just not too much to be worried about. You'll be fine. After my surgery, I went back to the hotel. 2 trans men, friends from Baltimore, came to my surgery to kind of help me and support my girlfriend. So I went back to the hotel where Troy was staying. He's my friend that I got surgery with, and that is definitely a good experience. If you can, try to schedule surgery with someone you know, or maybe you can find someone on YouTube. It's really a good thing to go through together. It's fun. So I got back to the hotel, felt totally fine. I was even cooking like pasta. We were hungry, we ordered pizza. Dr. Fischer called. She's like, remember, you just had major surgery. She's like, it sounds like a party there. So we had 4 trans guys, including me and Troy, and then, the girl I was dating at the time, and then Troy's mom, but it was fine. I felt good. I was up, I was lucid, I didn't feel too drugged out, wasn't in too much pain. I think if you just take your painkillers they prescribe you, it's scheduled, you'll be fine. Some people don't even need to take them. After a few days they're fine, they don't get much pain at all. Other people, their pain tolerance doesn't seem to be as high, so they need to be on the painkillers longer, or sometimes it seems older transitioners have more of a tough time, and sometimes I even see that they're bedridden after chest surgery, but most young guys I've seen definitely seem to recover fast, and you have to remember not to recover too fast, because I've known guys that just mess their chests up and widen their scars by doing things like getting a 6-pack out of the refrigerator and then the scars go or just riding a bike because they feel so good. So you gotta remember not to overdo it. You should also not go in a pool or hot tub for 2 months. Dr. Fischer talked about the bacteria getting in and stuff, so you just don't want to do that. You should wait about 6 weeks to begin exercising again, and just be really careful with it. Take it easy, and definitely don't lift your arms up. If you're going to surgery alone, you'll need to figure out a way to someone help you with your baggage, and driving after surgery is not a good idea. I had to wait a couple weeks to do that. It was even, kind of painful doing that. So definitely limit your arm movement. You gotta be mindful. It's so hard to want to go out. You want to go out in the sun. You should put sunscreen over your scars. I lived in Florida at the time. The last thing I wanted to do was wear a shirt at the pool or the beach, but I really wanted my scars to heal well, so that's what I did. I put sunscreen on them and always wore a shirt. Except at night. I could go swimming shirtless, and even just wearing a t-shirt against a flat chest is nice. I hope that helps answer some of the questions you have. If you'd like me to go further into something, or if you have a question that I didn't answer here, feel free to leave a comment in the video, and I will make another video replying to the comments and questions I get. And good luck to Kaleb and everyone getting surgery soon. That's awesome. Take care, everyone. Enjoy the rest of your week. Peace.